Beyond Patient Management, Healthcare by Design, by Denise Tahara and Mary McBride. Abstract. According to the Congressional Budget Office, as a result of the passage of the Patient Protection and Affordable Care Act, an additional 32 million Americans will have health care coverage by 2019. With increased participation, an environment needs to be constructed to encourage wellness and healthy behaviors, improve utilization, and contain costs. Today, we will explore how strategic design and design management can reframe healthcare encounters and community outreach to facilitate appropriate utilization of the system and create an environment that supports healthy lifestyle choices. Strategic design. Designers are trained to discover, define, design, and deliver needs-based services effectively, efficiently, and with a keen understanding of the rapidly changing demands of a diverse set of participants. Improving access and utilization is the intent of the healthcare system. Strategic design is essential as the factors that influence system-wide cost containment are dependent upon its design and its use. The design should not require a trade-off, increasing well-being versus decreasing costs. The goal should be to optimize the system and therefore improve both. Where are we now? Currently, 32 million Americans are uninsured. Add to that, we have the highest per capita expenditures of developed countries. We believe that the Affordable Care Act legislation is first and foremost a design. The passage of the Affordable Care Act has its intent, the organizing of an experience, healthcare, to allow for expanded service and increased participation in the system. The design intent cannot be delivered on without significant redesign of the way healthcare is defined and delivered. Strategic design can be used to enable the legislation to move beyond an environment that requires compliance and toward a system where commitment and conscious use are designed in. If we are to succeed, we need a new design brief that takes into account the current system and its capacity and challenges, and matches these to the needs of the current and new user groups. Designers understand that cultural norms and socioeconomic factors influence how participants access and utilize the system. They bring that perspective to the strategic design of the system through use of a design brief. Strategic design. This process for developing the requisite brief is familiar to designers. We would start with imagining a system designed to provide access to the healthcare service experience to those who currently are uninsured and to reduce overall healthcare spending while simultaneously increasing the well-being of users and by doing so decreasing the long-term costs of healthcare delivery. Discover the possibilities and challenges of delivering the needed services. Define the design criteria for successful service experience. Design that experience into a prototype that can be introduced for testing and refinement before full delivery. Deliver services that promote health and well-being. The challenge becomes how to achieve an optimized system where health and well-being drive the service encounters. We need to design healthcare service interactions to address the needs of specific and varying user groups and subsystems to improve compliance with wellness and treatment protocols. Experimenting with prototype delivery systems can facilitate achievement of desired health outcomes. Metrics can be developed to monitor and evaluate the newly designed system. Where do we want to be? We want to execute on the intent of the Affordable Care Act as well as its objective and to design a system that enables. What is the strategic intent of the Affordable Care Act? How do we design in the needs of patients? Legislators and patients all want the same thing: citizens who live productive and healthy lives. Productivity is related to well-being and health. Strategic design can deliver on this. Design managers view the service experience from the patient's perspective. Strategic design and design management can reframe healthcare encounters, community outreach to encourage healthy behaviors and wellness. The strategic intent is appropriate utilization of the system and to create an environment that supports healthy lifestyle choices. Designers understand the challenges faced by new participants in the healthcare system, as well as those who utilize the system for sporadic, episodic care that does not treat the whole patient or family system. The design challenge. Newly covered participants in the healthcare system have never accessed or utilized the healthcare system before. New participants enter the system unprepared to identify the service they can utilize or negotiate its terms. Others have accessed the system for episodic treatment, not for wellness and well-being. Treatment is disease-specific or chief complaint-specific. Many people have not experienced regular care and are not referred by a primary care physician. Therefore, the service experience design must begin before they enter a healthcare facility. These new participants create a design challenge around both operations management and capacity. Part of the process of discovery would require the design team to work with providers to evaluate current flows, identify non-value-added processes, redundancies, gaps, bottlenecks, and capacity limiters. We need to design the existing process flows to accommodate additional participants without diminishing quality or raising costs. Therefore, we must direct participants to the appropriate point of entry. The service experience must be designed to improve the health and wellness of the population by engaging participants in behaviors that can be maintained and can sustain well-being outside the system of service delivery. Opportunities for community support for healthy lifestyle decisions must be designed in. Health must be incorporated into every aspect of society and daily life. We continue our discussion in our second video. Thank you.